Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Well, we have learned so much about medicine over the many years, and somehow it keeps changing. And when I meet a doctor that's in the middle of this changing, I really like to get him on the radio so he can share what he's doing, and so many of our listeners can take advantage of someone who's really on cutting edge. It's called functional medicine. We're going to let Dr. FREDERICO Martinez, who is a Florida licensed medical doctor, talk about this. Now, one thing, he is from Lima, Peru, and that's one of the favorite places that I love. And so he's very charming, and he has this wonderful Peruvian accent, and you're going to really like this. But what I want to do is get Dr. Martinez to tell a little bit about why you're a different kind of a doctor, Dr. Martinez, than just an MD, who examines you and then tells you the kind of medication you need to feel better.
Hi, Anita. How you doing? It is a pleasure to be here with you in your wonderful program and to share this information with you and all of this beautiful, beautiful town of South Florida. Well, functional medicine, it is different approach of how doctors should see patients. Number one, I think it's very important that we spend more time with the patients, not the typical conventional approach in which you just spend at the most, maybe 10 or 15 minutes with the patient. And in functional medicine, we address the root cause, and this is really crucial in the concept of functional medicine. Go to the root cause of the conditions. As you know, just to give a little example, for example, overweight, obesity, diabetes, high blood pressure, high cholesterol, dementia, Alzheimer, anxiety, depression, even cancer, acid reflux. All of these conditions, do you know that they only have one major cause? It's called inflammation. This is chronic inflammation. Chronic inflammation is a condition that is so frequent, and yet when you go to your doctor, they don't even test for this. There is one test that actually can save your life. It's called the C-reactive protein. So I encourage you and everybody who is listening to us is to ask for this test, because this test is a marker for inflammation. It should be, for example, less than 1. If you have a level of 7, 10, etc., that means that you are on fire inside. And this inflammation is a silent killer because it's destroying your internal organs, your heart, your kidneys, your liver, even your brain. So I think it's very, very important to determine if somebody has inflammation. This is very, very important. It's vital in order to treat your chronic conditions.
Because we can't really see inflammation, right, when it's inside.
Exactly. And also it develops so slowly that sometimes you don't even notice. And what drives inflammation is, the cause number one is the intake of too much sugar or carbohydrates. There are other causes, of course, for example, heating infections, food sensitivities, etc. So, but the most important cause is the intake of too much sugar, especially the high fructose corn syrup that is present in almost every single item in the supermarket. So it's very important to read the labels of the foods that you're going to buy.
But one thing, I don't want anyone to think that they shouldn't eat fruit. That's a different kind of fructose, right?
Exactly, because the fructose in fruits also contain fiber, and fiber kind of temper a little bit the effect of the fructose. So it slows down the absorption at the intestinal level of the fructose that you eat. Of course, you're not going to eat a lot of fruits. Also, you have to, the name of the game here is to mix your food intake. Vegetables, fruits, some carbohydrates, of course, especially the ones who have a low glycemic index. That means that they don't have too much sugar. And, of course, your proteins, mainly from fish. They are more healthy. And if you're going to eat red meat, try to eat the grass-fed red meat. Very, very important. Now, as far as chicken is concerned, it should be hormone-free and antibiotic-free. Those are the basic recommendations for nutrition in order to avoid inflammation. Inflammation is the major root cause of chronic condition.
So, Dr. Martinez, when you have patients, do you literally sit down with them and find out what they eat and then give them a different diet?
Exactly. Well, when I see a patient, basically what we do is we spend a lot of time, sometimes an hour and a half to 2 hours, depending on the case, and we go back on time. We actually construct a timeline in our patients in which we describe what are the current problems, and then we go back even to the conception time, antecedents, any triggering factors, any mediators that are perpetuating the condition. And then we analyze how is the sleep, how is the nutrition, how is the stress level, how is the movement and the exercise pattern of that person, and even we explore the relationships of that person. In this way, we build what we call a matrix with this information, and we see if the patient is assimilating well, how are the defenses, how is the hormone pattern, circulation, biotransformation and excretion, and how is, for example, the energy level, and so on. So this way, when we construct this matrix, we can pretty much tell if there is a connection. And that's what a functional medical doctor is. We connect the dots.
Okay, well, this is great. So Dr. Frederico Martinez, Medical Director, Physician, Healthpark Medical Center. He is talking about functional medicine. I'm Anita Finley, and you're listening to some pretty cutting-edge information, which I love. So keep going.
Well, now, don't get me wrong. We use conventional medications too, but we don't use it for too long. We see a lot of patients who come to the office with 10 different bottles, one medication for each symptom. And that's what really gets me enthusiastic about trying to change that. How? Basically, we explore the root causes of that chronic condition, and we try to address how we can help that person. For example, last week I saw a patient, 40-year-old, tremendous fatigue. She was tired all the time. She had a lot of episodes of crying, and she was actually achy everywhere. So, of course, she went to different doctors for these conditions, and she was told that she had fibromyalgia, the famous fibromyalgia, and that she was depressed. So she was given all of these even pain medications, and she was given an antidepressant. Of course, she didn't get any help. Finally, she went to my office, and she was referred for a very, very good patient of mine. And we did a physical examination. Of course, we did a timeline, and we did the matrix and so on. And we discovered that this patient had so many conditions that were related to the current problems. One of them is that she was exposed to a lot of antibiotics in the past 5 years because of recurrent urinary tract infections. So she was giving antibiotics, sometimes 2-3 courses of antibiotics in a period of 6 months. And as you know, when you take so many antibiotics, you destroy your intestinal microbiome, your healthy bacteria is destroyed. And now the clinical evidence is mounting. Every single day we receive information how important it is to have healthy bacteria in your intestine, because those bacteria actually communicate with your brain, with your heart, with your liver, with your kidney, with your whole body. So, and also is incriminated in human behavior. So I started her on probiotics, I gave her prebiotics or fiber, some pancreatic enzymes. We did a blood test, and sure enough, she had very low levels of thyroid hormone, so she was hypothyroid. And also she had very high levels of antibodies against her thyroid. So there was an issue here with maybe gluten sensitivity. So the other thing that she had was a very high levels of homocysteine levels, and those homocysteine reveals that there was a genetic problem with an enzyme called MTHFR. So of course she has been placed on medications, and I received a phone call yesterday that she was feeling much, much better. She even told me, I haven't felt this good for the past 7 years.
So that's very important that you bring that up, Dr. Martinez, because here you have someone that's been to doctors and they were responding because she felt bad, and now she's loaded with medication, and they're not doing any of the things that you're talking about, and yours are very simple. It sounds like it just needed someone to do what you do. Timeline, what are you taking?
And listen to the history. Perform a very good physical examination. Spend some time with your patient. And in this way, you will discover a lot of things. Sometimes you start talking to the patient, and the patient is not only telling you very important.
Oh, that's what it was.
Very, very important data, but also when you do a physical examination and spend some time, you discover an amazing number of conditions that, if you don't do this type of service, it will be unnoticed. That's why I think it's important to spend with your patient a good amount of time.
Is that what functional medicine means?
Yes, it's listening to the patient, is actually talking to the patient and having eye contact with the patient, which, and all of this came about because there is nothing better than conventional medicine for acute problems. But when you extrapolate that model to chronic diseases, that's when the medicine fails. Because, like I say, if you have a heart attack, if you have appendicitis, if you have any trauma, any accidents, there is nothing better than conventional medicine, But you cannot extrapolate that model into chronic diseases. Chronic diseases are a different ballgame. You have to explore every single cause that may be accounting for this problem.
I want, for our listeners, if you want to get in touch with Dr. Martinez and hear more about this, let me give you his website. It's healthparkmedical.com, healthparkmedical.com, or you can call 954-573-5464. That's 954-573-5464. And Dr. Martinez, Dr. Federico Martinez, is located in Weston. But I have to just tell you, it is rare to find someone with his expertise and the way that you handle this. I know there are so many people who have been misdiagnosed, and it sounds like you are almost a diagnostic physician. I'm getting that feeling more and more.
Yes, of course.
And that I know that we've talked about stem cells, we've talked about integrative medicine, regenerative medicine, and how did this all happen for you? I mean, where did this start?
Well, personally, I had a very tragic event in my life. My wife got sick with lung cancer, and she passed away about 8 years ago. And I saw how she was treated in different centers, because of course, as a husband who is a doctor, I try every single place in order to help her. But the situation was that I saw all of this chemotherapy, radiotherapy, surgery, all of these toxic medications given to her, and she passed away about 8 years ago after 3 years battling with this condition. That really made me change my route, and I started to explore other ways of helping people, and this is exactly what I'm doing. Now, in our practice, I sometimes I use conventional medications, but for a short period of time. Those medications are not intended to be given for forever, you know? And this is exactly what we see every single day. I see patients who come to the office, like I said, with 20 different bottles, one for each symptom, because they are trying just to band-aid the symptoms. And these people, sooner or later are going to develop also side effects. And guess what? Sometimes one medication interacts with the other one. So sometimes you take 2-3 medications, but they're doing nothing in your body, just adding more side effects because they actually block or cancel the effect because of the interactions. So we see this on a daily basis, and that's what we're trying to change. This is the new approach. It's called functional medicine. And like I said, even though we use medication, sometimes they are not intended to be used forever. We try to find the cause and target the cause. Now, in addition to this, of course, we also use biological therapies. For example, PRPs. There are some patients who come with problems in the knee, problems in the elbow, problems in the shoulder, as a consequence of a long-standing inflammation for many years. They destroy, basically, the joints. And that's when we also intervene, not only controlling the inflammation, but also trying to take care of the consequences of this inflammation, which is destruction of the tissues. And in this way, what we do is we use PRP,
which is that stem cell
platelet-rich plasma injections. Platelet-rich plasma injections.
Of their own. This is their own.
Exactly. This is
cells.
Your own blood. We take the blood. We separate the platelets. These platelets contain growth factors, and when you inject this in the affected tissues, these growth factors are going to basically repair those ligaments, repair different structures in your joints. Patients usually within 2 weeks start feeling much better, and it's just amazing. It's almost, they almost say it's a miracle. So we do use those therapies in those selected patients. There are many, many patients who come with inflammation, and of course, we have to find what is the cause. But one of the things that we do is we try to emphasize nutrition. As you know, we only eat 2 types of foods: the micronutrients and the macronutrients. Macronutrients are typically fats, proteins, and carbohydrates. They give you basic calories, but they don't give you the other important elements for cellular function. On the other hand, micronutrients, they are the antioxidants, anti-inflammatory agents, anti-cancer agents, phytochemicals, vitamins, minerals, etc. So, of course, when we recommend nutrition to our patients, we try to tell them that they need to eat more micronutrients. For example, 1 handful of kale contains 25 anti-inflammatories, over 20 anti-cancer agents, a lot of antioxidants, has, for example, vitamin A, D, E, K, minerals, phytochemicals. 1 pound of kale. Now, you compare 1 pound of kale with 1 pound of pasta.
I don't think so.
Pasta has a lot of calories, but they don't have these elements that are very important for cellular function. So this is what we have to eat. My recommendation is always make the salad your main dish. Make the salad your main dish. Then you will be sure that you will eat enough amounts of micronutrients.
But make sure you have the kale. It's funny you should mention that, because I now go to the grocery store and they have a whole bag of mixed salad with lots of kale in it. It's fantastic. So yes. I'm now on the kale diet.
Right.
Thank you very much.
That's wonderful. Yes. And of course, it's important recommendation also to eat organic. If you eat organic, then there will be no GMOs, no pesticides, no herbicides, no fungicides, because those are very toxic to your system as well. So you have to avoid that.
Your patients are very lucky. Do you know that?
I mean, in addition to nutrition, you have to also make sure that your hormones are balanced, and that's what we do in our office too. We balance the hormones. As you know, we all experience a decline in our hormones after age 35 years old. So it is very important to test for these hormone deficiencies, because remember, hormones are chemical messengers between cells. If you don't have those messengers, then your body is going to suffer, and then your adrenals are going to start working harder, and then you may develop what we call adrenal fatigue, which is another very important condition to be mentioned. In addition to that, of course, we try to tell people also to create their own environment, stay away from negative people, try to decrease their stress levels, yoga, meditation. The other important thing is any method of relaxation would be very, very, very crucial in order to stay healthy. And the last thing is that we do is also try to remove toxic elements from your body. For example, heavy metals intoxication is a reality. Many people, especially the seafood lovers, they have high levels of mercury, and that mercury interferes with a lot of functions in your cell. So we need to determine if a person has heavy metals intoxication in order to be treated. So this is a very comprehensive type of treatment that we provide in our services.
Let me just tell everybody again, you're listening to Dr. Federico Martinez, who is the medical director and physician at Healthpark Medical Center. And that's located at 2300 North Commerce Parkway, Suite 321 in Weston. You can make an appointment. Just remember, this is Pencil Talk Radio. Get your pencils out and write these numbers down. It's 954-573-5464, or you can go on the web to healthparkmedical.com, healthparkmedical.com. Before we run out of time, Dr. Martinez, tell me if people are listening, what of all the things that you've said, and we're going to be having you on a lot of other times, you're going to be able to hear Dr. Martinez because we're going to schedule a lot of radio shows, and just tell me what you think the most important thing a person can do to maintain his or her health. And remember, you only get one. What is it? One thing.
Nutrition.
Okay.
It's number one, nutrition. And if people can do this and try to, it would be very, very healthy to do a little maneuver here. Number one, elimination diet. I think elimination diet is very important in every single person to do once in a while. I would say probably every 3-4 months, you should do an elimination diet for a week.
You're being very polite about it. So elimination diet means clean yourself out, right?
Exactly. So the most important thing is, try to get into the habit of eating more vegetables and fruits. Because as I explained to you, those contain micronutrients that's what the cell need to function well. Number 2, gluten-free diet. Gluten-free diet is very important because gluten has been identified as the major cause of an inflammatory process in the intestine. They say that death begins in the colon, and that is very true. We have to take care of our intestines. Now, how do we take care of that? Very important. Gluten-free diet. Eliminate milk or dairy products. That's another important one. Why? Because milk contains casein. Casein is a protein that is highly inflammatory to the intestine.
So no more yogurt?
No more yogurt. You can use coconut yogurt. Yes.
Coconut yogurt.
Yes.
On your next show, you have to remember to bring a lot of this with you
Of
because
course,
this is going to be fun. So I can't have, I don't want my bread, and I can't have regular yogurt, but I have coconut yogurt.
Yes.
I've never even heard of that.
Of course. Now, the other important thing that I recommend is to use probiotics. Probiotics, 30 to 60 billion of healthy bacteria, especially the ones that contain bifidobacteria, lactobacillus, and Saccharomyces boulardii. I'm going to repeat it again. Bifidobacteria, lactobacillus, and Saccharomyces boulardii. Those are the main germs or healthy bacteria that you should you should take every single day, 30 to 60 billion daily. So those bacteria, believe it or not, are going to communicate with your brain, are going to send the right messages to your brain. Dr. David Perlmutter has written a wonderful book on this. It just came out 2 weeks ago. It's called Brain Maker. And this book, he actually talks about the connection between the gut and the brain. Remember, your brain is less than 2 pounds in weight. The number of bacteria that we have in our intestines are trillions and trillions, and the weight of those bacteria in our intestine is over 2 pounds. So actually, our gut, if you want to call it this way, is your second brain, and is very important in order to stay healthy.
I can see an article. Your brain is your second gut. That's very good. I mean, yes. I'm very impressed with everything I'm learning here. I can't write fast enough to keep up with you, but I think you've been giving us a lot of very good information.
Well, that's the last thing is that I want to tell you. That's why antibiotics may be life-saving in certain conditions, but you cannot use in an indiscriminated way antibiotics for every little cold because you destroy your healthy bacteria. If you're going to use antibiotics, you have to tell your doctor, please, I want to have some probiotics after this, And actually, probiotics should be used every single day.
And can you use it while you're taking the antibiotic?
Of course, yes.
I'm going out to buy probiotics. I did not realize this. I have learned so much from you today. Yes. I hope everybody else has. We're going to have Dr. Martinez back again another time. Dr. Frederico Martinez, and you can call him at 954-573-5464. Sounds like there's going to be a lot of people who really want to know more about functional medicine. Thank you for being with us.
Thank you so much, Anita. It's a pleasure to be with you.